Hello. Thank you for your patience. My name's Dr. Oh, it's you. I didn't realise you were my next patient. Hope you weren't waiting long. That's good to hear. I certainly do my best to keep a punctual schedule. I dislike being behind on my appointments. Patients getting frustrated, making my job harder. Nobody likes the dentist. You really don't mind so much? You enjoy me taking care of you? Well, that's lovely to hear, actually. I don't hear that often. Okay, let's take a look at your chart, shall we? Ah, it looks like you're experiencing constant pain on the lower left of your mouth, especially when chewing or biting. But you have pain all the time, is that correct? And how long have you been experiencing this pain? Oh, that's quite a long time. You poor thing. You shouldn't have to suffer for so long. Didn't you consider coming in sooner? I see. You thought the pain was temporary. Wait, the reception said I didn't have any openings until today? Well, that's unacceptable. Of course I would have fit you in sooner. I'll have a talk with her later. No matter. You're here now. That's what is important. Now, let me get some gloves on and prepare my tools. Alright, open your mouth wide. Let's take a look. You still have your wisdom teeth, is that correct? Yes, we did remove your lower right ones previously because it was impacted, but we didn't remove the other three. Well, my dear, it looks like your lower left wisdom tooth is causing an infection. We're going to need to remove that one. Yes, sometimes antibiotics alone could help, but in my professional opinion, removing the tooth will help you in the long run. Besides, removing the infection, this will ensure no more infections occur there. I know the news can be disturbing to hear, but not to worry, because you're here, with me. I'll take care of everything. Very good. I'll just fetch some additional tools and anaesthetic and... I'm sorry, did you say something? Do you have a question? Oh, my necklace? Yes, I always wear it. I never take it off. Why do I keep it on? It reminds me of someone special. No, I can't tell you. I won't show you. Not yet, not yet. Sorry about that. I lost my train of thought briefly. Yes, the surgery. We should perform it today. Is there a problem with that? Of course you're nervous, but I promise you, the sooner we perform the surgery, the faster the pain will dissipate. You'll feel better, and that would bring me such joy. Yes, it's safe to proceed with treatment today. You didn't eat breakfast, so it's safe to give anaesthetics, and I have plenty of time in my schedule at the moment. We wouldn't want you to be in any more pain now, would we? How do I know you didn't eat breakfast? Well, you've told me before that you don't eat before your dentist appointments. You don't remember telling me that? Well, how else would I know? Anyway, excuse me a moment, dear. I'll return shortly. You look nervous. Don't be. You're in great hands. My hands. You trust me, don't you? Perfect. Now, you won't need too much medication. Just a local anaesthetic and a general relaxant. That should take only a moment before it takes effect. I am truly sorry for this. Normally you only occasionally come in for minor cavities, probably because of all the candies and chocolates you consume. How did I know you eat a lot of sweets? Occam's razor. The more sweets you consume, the higher percentage of dental disease. But how did I know you eat a lot of sweets? My dear, who do you think sends you those treats, Your birthday, Valentine's Day, Christmas, Thanksgiving, Halloween, every occasion I can think of. Yes, it was me. I confess. You've been my patient for years, but I knew from our first appointment, I knew that you were meant for me. Your beautiful smile, your perfect smile. I adore you. I would always make sure our appointment times were longer just so I could spend as much time with you as possible. But seeing you twice a year was becoming too painful. I couldn't wait that long to see you again. It was simple. The clinic has all your information. Your full name, your phone number, your home address, your place of work. So I took it upon myself to send you gifts. The chocolates, the candies, the cake. It pained me to ruin your teeth. Sending you sweets so you would develop cavities. But I had to. Don't you see? I had to so I could see you smile. So I could see your eyes, see your lips. You consume my every waking thought. You intrude into my dreams at night. I had no choice. And I don't like seeing you in pain. But knowing that I was the one to heal you, all I want is to take care of you. Even those extra appointments weren't enough anymore. I learned who was in your life, what your eating habits were, where you go after work, how you relax at home. If I wasn't stuck working in this suffocating clinic, I was watching you. That's how I knew you don't eat breakfast before our appointments. That's how I know you enjoyed the desserts I sent to your house and work. And since I know that you still had wisdom teeth, well, your x-rays indicated that you were prone to develop an infection on this wisdom tooth. I even planned to only extract a single as opposed to removing all your wisdom teeth at once, in hopes that eventually you will have to come back, at least 3 extra times. Yes, of course. I knew you were my next appointment. I even made sure not to have anyone else on the schedule for the rest of the day. I saw what the appointment synopsis and knew my plan eventually worked. I needed to ensure that no one would interrupt our time together today. I have the rest of the day to develop all my time just for you. I'm here to take care of you. It's all I've ever wanted. All I even think about. And my necklace. The one you noticed. Do you recognize it? It's yours. Your wisdom tooth. Yes, from the previous surgery. I cleaned it, I kept it, and I always wear it, so I can keep you as close to me as possible. You know how hilarious this is? The irony is astonishing. I've had patients inflict damage and cause infections on purpose just to come see me more often, to get my attention, to pursue my affections, but I always pushed them away. Not only were they not my type, but I thought those doctor and patient stories were too ridiculous. I've heard rumours about colleagues, and there's those cliché fantasies that people create in books or movies or whatever. But then you walked in. Why did you do that? Why did you take my heart in one glance? With just a smile? My apologies, dear. I've been rambling. I'm sure you must have some questions for me. You have nothing to say? Or is it that you can't? It looks like the anesthetics are in effect. Now just relax. Let me take care of you. See? That wasn't so bad. It didn't take long at all. Still no words? That's all right. I'm sure you're feeling sleepy. Your mouth is numb. Let me just run my thumb across your lip. Oh, my dear. They're a little swollen. That's normal. Don't worry. You'll feel better shortly. In fact, I'll just take you home with me. I'll attend to your every need. I'll make your food, give you your medications, and give you all of my attention. I have a lovely bedroom, you know. A bed that is like a cloud. Satin sheets with plenty of pillows. Soft blankets galore. I'll even make sure the TV's hooked up. You can watch anything you like. I've got plenty of books for you to choose from if you prefer. You'll need for nothing. I'll give you anything and everything you could ever want. Shh, hush, dear. Don't cry. Are you in pain? Perhaps I should give you more sedation. It should last until we get home. It'll be all right, my dear. Let me wipe those tears away. See? All better. I'll take care of everything. You're in trustworthy hands.